My name is Harley Keisch. I am from Berkshire Medical Center, where I work at the critical care unit on 12-hour night shifts. I never get a lunch break. The reason that I do is because I don't want to burden my colleagues with taking the third and fourth patient, which is what we do. I would concur with both my colleagues here that the conditions are very similar, and the management attitude is the same. I do want to say that in the presence of facts, opinions should have no sway. And I think it's been well documented, extremely well documented, that the intent of the legislature in passing this law was that the default safe standard of care in all hospitals is one nurse to one patient, and this is without regards to cost. There's nothing in the law that is saying it's a cost-cutting law, it's a cost-containment law. And I know that the Health Policy Commission is very involved in those issues. It's part of their mandate. But in this case, you've been handed something that really, it just doesn't speak to that. It's about quality of care. And I think that we should be mindful of that. I guess I want to try to skip ahead here because I want to give you some time. I guess there was some testimony that I would concur with from last time. One is that Dave Sherman mentioned, and also Janet Raposa, that it would be nice if the patients' families or the patients could be informed of their rights under this law. It's almost like the Bill of Rights for patients. They should know that this exists and that they have the right, that the legislature, the people of Massachusetts, through their duly elected representatives in a democratic process, said, hey, you have this right to, you're entitled to have one-on-one care. They should be informed of that. And I think, at a practical level, that's going to change management attitudes. Because if the one thing that's going to change their attitudes is one of the patient's family members coming in and saying, hey, why is it that I've got a nurse here who's gone on break and now the other nurse has 3 patients? They should be able to advocate for themselves, and we should be able to advocate for them. Which brings me to my final point, which is that, where I work in Berkshire County, I work in a monopoly health system. There is only one employer for critical care nurses in Berkshire County. Most of my colleagues are afraid to speak up at all. It's almost as if they're abused spouses. One of my colleagues told me the other day is, Harley, we just take a beating and shut our mouths. And that's just how it is there. They have families that are moving. That's just the way it is. Well, I would like to see almost like a whistleblower type of protection put into the law so that for folks that are willing to advocate for their patients one-to-one, and I don't care which employee it is, whether it's a staff nurse or an orderly that's working with us or anyone, that they are protected from any disciplinary action or retaliation by their employer. Because otherwise, at least where I work, it's going to be very difficult to make this change happen. Thank you very much.
Thank you.